We're going to start with you, Terra. Why don't you first introduce yourself and let folks here know who you are and what type of cancer you have experienced.
Well, before cancer, I thought I was a normal person. I have had advanced metastatic melanoma. I've had 13 tumors, 12 metastasized in my neck and brain. I had cancer for 18 months before treatment existed for me, other than surgery. I have been through a lot. Wow, I don't even know where to go from there.
Well, let's go to Oswald then.
I'm very
We'll come
excited
back.
to
We're
be
going to
here
get to
for
hear
you
so
today.
much about it. Oswald, tell us who you are and what type of cancer you were diagnosed with.
All right, good afternoon. My name is Oswald Peterson. In 2017, I was diagnosed with a very advanced form of stage 4 lung cancer. I was at Columbia Presbyterian, and the doctors introduced me to the immunotherapy that quickly turned me around. It was a lifesaver. Because at that time, having been a caregiver to my mother who also passed of cancer, I knew at stage 4 advanced lung that my time was kind of limited. Mm-hmm. The cancer had spread to my spine. I had cancerous nodules in my chest, blood clots in my back, fluid on my lungs, fluid in my heart, and my whole left lung was basically a cancer. Right. When they did the x-rays, it looked like I had one lung.
It's crazy. Dorothy,
first I should say that the reason why I'm lame has nothing to do with the cancer. I was struck by a car a year ago, June, and I've had 2.5 operations since then. I've had a knee replacement, so it has nothing to do with my treatment. In March of this year, only March, I was diagnosed with esophageal cancer. And my first symptom was difficulty swallowing a big pill, a capsule, a high-strength fish oil, which I've been taking for 20 years, and it suddenly lodged in my throat or my gullet, and it was terrifying. I thought I was having a heart attack. This was only in mid-March, and I was treated with immunotherapy here at Perlmutter, and I had this treatment was concurrent with chemo and radiation. And in August, just a 5-month span, I was deemed by endoscopy and also by way of biopsy to be free of cancer. And it was serious enough when it was diagnosed. The esophagus has layers, 4 of them I understand. And my tumor had progressed to the 4th layer. What I had going for me from the beginning was that it hadn't pierced through into the surrounding areas, so it didn't infect, for example, the lymph system. But it seems remarkable to me that it was a 5-month span. It's astonishing. I still find it astonishing to look back over it.
So the two of you got this diagnosis, got this weird thing called immunotherapy, maybe never heard of before, and then within months.
Yeah.
Well, for me, my turnaround was really quick.
Yeah.
I was in the hospital for about 3 months. I left the hospital in March. When I left the hospital, I had lost somewhere like about 45, almost 50 pounds. I left the hospital, they gave me an oxygen tank, they delivered an oxygen machine to my house, and I was like, okay, wow, this is my new normal. But I got back into the gym, and literally within a month, I gained back 40 pounds. I went from not being able to walk across the room without losing my breath to doing an hour on the elliptical and the step machine. So my turnaround was really, really dramatic and really quick.
And now let's give that. I mean, that's fantastic. Now, Terra, that's completely different from your journey was a lot longer there. Should be on.
Can you hear me?
Hold it up to your mouth.
Can you hear me?
Yeah.
There you go. I've had 4 massive surgeries, including brain surgery. And in 2016, I actually had brain surgery and another 7-hour surgery 6 weeks apart. not having any idea I was going to have that second surgery. I also had seizures for 8 months. And it's really funny because, you know, we have so much fear. I always try to look at everything from, okay, what's positive about today? When cancer metastasized to my brain, I then became eligible for the treatment that I wanted. And I was actually saying, thank you, brain cancer.
Wow.
Because it was the first time I was actually able to have treatment. And that's actually how I started on immunotherapy. And I want to share with you that today, this month, September, is different than theirs. This month is my 35th month on immunotherapy. As of July, after all of that whole incredible experience, as of July, my scans show I have no tumors.
It's amazing.
It's actually been so huge for me that I was afraid to even tell anybody, because it's been just as shocking for me in the last 6 weeks as it was when I was diagnosed stage 3 and stage 4.
Well, you know, I've heard from other patients that who are receiving immunotherapy that their coworkers and friends may not even know that they're facing cancer or undergoing treatment. In fact, friends will say to them when they find out, you don't look like you have cancer. It's a completely different experience. When did you first hear about immunotherapy, and how was it explained to you?
Well, I first heard about immunotherapy the first year in 2015 when they first found the initial site, which my hairdresser found on the top of my head. And I had no symptoms. I had surgery, and all the margins came back clear, so I was considered cancer-free. But my doctors did tell me at that time, because they have to tell you the facts and the information, and they did tell me, first of all, that if it did return, that I would have a 25% chance of survival and probably 5 years to live. And they did tell me that there was very progressive success happening in short-term trials for melanoma with immunotherapy. And so they were giving me something hopeful to look forward to. My margins did come back clear. I was considered cancer-free, and then exactly a year later it metastasized. And that really, in my brain, is when my journey began.
How did they explain immunotherapy to you? Did it make sense to you right away? Did you care? Some people are like, whatever, just give me what you think is going to work, doc.
Well, I was initially told that chemo and radiation was not an option for melanoma, that it was really, at this point, used as a last resort. I will be honest, I'm really happy I didn't have to make that decision. I have become a cancer patient advocate, and I'm very clear with anybody who is or has been on chemo that that is not a decision that I had to make. That's not an experience I have had. I knew that it would boost my immune system. I knew that it would help my immune system help itself and help to fight the cancer. Not knowing I was going to have as many surgeries as I did. I don't know, I wanted to be cancer-free.
Mm-hmm. Oswald, when you first heard that word immunotherapy, what did you think? Did you have any questions, or how was it described to you?
The strange thing about it, I think that when you receive so much information like that, so many words are being thrown at you, few of them stick. So I was kind of looking for the buzzwords every time they came in. I was waiting to hear about chemo or waiting to hear about radiation. So when they said immunotherapy, it was something so new to me that I don't think it really stuck until they started to explain that this was something new that was specifically made for my type of cancer. So for me, it was totally something I had never heard of before, and especially just the prior year, I was a caregiver to my mother who had to go through the chemo and the radiation for her form of cancer. So I was expecting that was going to be the next course of action that would be taken with me. So when they announced that they were going to be using something new on me, the immunotherapy, I was just like she was, you know what? At this point in time, what do I have to lose? Let's just try it and see what happens. But it was definitely something I had never heard about before, never even seen anything about it online or anything. So it was definitely something new, but I'm so grateful that I had the opportunity to be introduced to it because it really did change my life.
Of course, now lung cancer is one of the cancers that's seen one of the most success, along with melanoma, in treatment with immunotherapy. Dorothy, when you heard the word immunotherapy, what went through your mind?
Well, I didn't exercise any judgment at all in advance.
Can you hold the mic to your mouth?
Oh, I didn't judge it at all in advance or have any views. I just thought I will give myself my best chance and take what's on offer. Mm-hmm. So it wasn't a very educated approach, but I didn't have any difficulty with it. I was, when I was diagnosed, my nephew, who's a doctor at Kings County, not in this specialty at all, he's an epidemiologist, he asked advice of a colleague, and that colleague recommended Perlmutter here, and in fact, a very specific oncologist here. I just followed orders, and immediately, I think on my first interview with her, she did accept me as a patient, and I suppose my nephew smoothed the way, I'm not sure. But she also asked me if I wanted to be in a study of, I'm not even sure if I heard immunology. I was a bit shocked because there had never been cancer in my family, not at all, and I thought this is one thing I'm not going to have. And my family is given to heart disease and eye diseases, never a hint of cancer anywhere. Although I'm 86 years old, so I'm in that cohort where cancer, any mention of cancer was kind of tamped down, but also in that age group, cancer to me was a death sentence, so I had no difficulty in accepting what was offered, and it was begun immediately. In fact, it was begun before, I should say that my oncologist recommended chemo and radiation together, and this experimental drug is called Opdivo. So I was given that alone, Opdivo alone, for a month. This would be the month of April. And in fact, the tumor shrank during that month, whereas I believe Opdivo is intended to be taken in concert with chemo and radiation as a supportive drug, but it helped me right off the bat.
Yeah,
and then it was continued through the next month.
It sometimes is given alone, but as I mentioned earlier, sometimes it's combined. So you were the only one up here actually who participated in a clinical trial, I believe, right, for immunotherapy. And your trial was specifically designed to have the immunotherapy, then plus the chemo and the radiation. Now, you told me something really funny on the phone. There was a member of your family who was upset about something. Why don't you share that story?
Yes, well, it was my nephew. He's sort of the family medical advisor, and he's never steered us wrong, so I was going to listen to him, but he wanted the chemo and radiation begun immediately. He's a kind of an Optung type of person. And he didn't like the idea of a month go by with the immunotherapy, but when it had such a good effect, he had no crank coming in him.
He wondered, I thought you said, why aren't you getting the real treatment first, right?
He wanted that to be really commenced instantly. Well, he of course himself was being guided by his colleague, who was an oncologist. So, well, it still astounds me looking back how brief this interval was from March to through the 9th of August.
Right. The thing is, everyone responds or doesn't respond differently to immunotherapy and in a different timetable. Mm-hmm. So it's really amazing that the both of you had quick responses like that. Mm-hmm. But as Terra said, she's been receiving it for a while now.
35 months, almost 3 years.
Did you have any fears about going to the trial? It sounds like you were I'm just going to do it, right?
No, I didn't know. I was a bit pessimistic. I thought, as I say, that I thought that I'll get my affairs in order, which for me meant, shredding some old income taxes or something. I just sort of braced myself for the worst, and I'm sort of surprised that I got the best.
So Terra, you had a lot of experience, unfortunately, with the cancer really never going away or coming back. When did you know that immunotherapy was doing the trick?
And I do want to share that I am actually in a clinical trial, but it is not immunotherapy. And in the trial that I am in, that was actually my first option. I was chosen actually for surgery instead of treatment, but I am in that trial. So I had 2 surgeries back-to-back, September and October of 2016. And then I started in November immunotherapy. And in January, I actually had 3 more tumors grow. And we did know from the very beginning of my journey that all of my tumors were very aggressive, and every single one of them grew very quickly. So, believe it or not, we were all very calm about it. And my surgeon had been very successful in my surgery. I actually had 6 tumors removed out of my neck. And again, these tumors appeared in my neck. So I knew he could go in there again if he had to. And, but we also knew that Keytruda will present itself in 3 to 4 months, whether it's whether it's probably going to work for you or whether it's going to be helpful and help to decrease the tumors. So we were only 2 months in. So I went to see my surgeon, I went to see my oncologist, we all talked about it, we decided to be calm, and 2 months later in March, my tumors had shrunk. So that was a huge, huge, huge celebration for me and a turning point for me, and that's when I really felt like, oh my God, I am going to beat this. Because up until that point, nothing had worked except for surgery.
Did your other symptoms, the seizures, did those start to go away also? Had those already disappeared?
No, I was still having seizures. And for one, a seizure is how they found the brain tumors. I had 3 small brain tumors. And then I had emergency surgery. And I had seizures again a couple months later. And then again a few months after that. And at that point I learned that when you have brain surgery, you can also continue to have seizures. They do not know. So it took us time to acclimate and to actually get come up with a good dosage that worked for me. That took 8 months. May of 2017, I had 4 seizures and ended up in a coma and on life support. My poor son, who is in the audience today with his girlfriend, and are my rocks, were there. I feel sorry for them because they're the ones who saw me, and when I was in this state, I don't have any memory of having seizures. And they were told that I probably wouldn't make it, and that if I did, I probably would have serious brain damage. So I call myself a cancer hope coach. And my mission is to give hope to as many cancer patients as I can. I have people call me from all over the country now who hear about my story. And I hope I give you as much hope today because I have been through a lot. And I am tumor-free, and I am becoming healthy, and I am overcoming this. And I also want to say that I am offended by the word survivor. And I don't want anyone else to be offended by that word, but I am offended by that word. I do not want to be a survivor. I want to thrive.
I think you also don't want to get hit by a bus. Let's just be clear about that. Okay. Now, what about the two of you? Oswald, start with you. Did you have any immunotherapy side effects or side effects that your doctors told you were a result of the immunotherapy?
Well, I remember initially they were saying that one of the things about immunotherapy is that you can become allergic to things that you might not have been allergic to before. So my only side effect in that regards was I had a skincare product that I used to use. I used it one time after immunotherapy and my face blew up the size of a football and my skin peeled. But afterwards, my skin looked really good. But my skin, for months, people were asking me, what are you using on your skin? And I'm like, immunotherapy. No. That was really the only side effect that I saw. Besides that, there was a little dip in my neutrophils,
a type of immune cell.
Right. There was a little dip in that, but not enough to where the doctors were concerned. And being there was something they had never looked at before, they think it might have been low to begin with, that the immunotherapy itself might not have been the cause. It was just something they noticed because of the immunotherapy. But besides that, my side effects were literally nothing. And the same result happened. When they initially told me about it, it wasn't something that, because it was so new at the time that I initially received it, that was supposed to make the cancer shrink. It wasn't supposed to make it go away. So when the first scan came back, my doctor didn't even want to tell me the results because she wanted something else to benchmark it by. So when the first results came back, she saw the shrinkage. The next scan, she then told me, you know what, it's shrinking. She said, I don't know how. And then finally when she said, you know what, I don't know what else to say but cancer-free. She said, but you have no sign of it. So the only side effect I had was the side effect with the skincare item, and that was it.
Dorothy, before I get your answer, you bring up a good point, and I'm not sure if the experts earlier today brought this up, but there's this thing called pseudo progression. So you're talking about scans where your tumor is shrinking, and that's how you know it's working. But there's this thing where as your immune cells infiltrate the tumor and killing the tumor, it can still appear on scans as if there's some mass there, and it's only with a biopsy that your doctor will know if it's really tumor or if it's just the remnant of the battle at the battleground. So I just wanted to put that out there too.
With that being said, just a quick regression. When they initially had drained the fluid from my lungs and my heart due to the cancer, they had said that most likely those fluids will come back. So they did set up appointments for it to be drained at a later date. But the immunotherapy started working so quickly that I got the first dose of immunotherapy, and the drainage was tentatively scheduled for like 2 weeks after that. When they went to check for the fluid, they realized the fluid hadn't come back, and that was the first sign that the immunotherapy had started to work.
Wow. And Dorothy, now the side effect question.
The side effects. Well, I was mercifully free of side effects for a long time. I told you that the month of May was my month for immunotherapy solely, and I had no side effects. Then the month of June commenced, and for the first half I was wonderful. I just lived down the road here in Stuyvesant Town, so I'd walk back and forth to Perlmutter every day. And to get some exercise. Of course, the physical therapy for my knee had to cease when the cancer struck, so I was glad of the exercise. But mid-month, that would be halfway through the month of getting all three, I was struck by, I guess you'd call it anorexia, complete loss of appetite. Not only loss of appetite, that doesn't begin to describe it. Food and drink, even water, became repugnant. We blame it, I think, on the radiation, not on the immunotherapy, but it was a serious enough symptom. I never had nausea, I never had pain, but this other was terrific because I resisted taking anything in at all. And the dietitian who was part of the team, the Perlmutter team, told me, you're in starvation mode. You simply have to take in some food and drink. I was in fact hospitalized for a couple of days for blood transfusions. And I had to come daily to Perlmutter for hydration, to get water. And my daughter, who she's a teacher up in Syracuse, she came down to be with me for 6 weeks. She essentially functioned as a private duty nurse. She was wonderful. She was at her wit's end. The dietitian was at her wit's end. They treated me like the way you treat a child. You maybe sneak some egg into its spinach or something. But it was. I wasn't being difficult. It was impossible to take anything in. So, and that lasted for a good month. It was explained that radiation zaps the taste buds. They revive over time. But in the meantime, apparently there's nothing to be done about it except fight it. It was touch and go. It really was. It's an odd symptom. I had appetite, but but I couldn't tolerate food or drink of any kind.
Yeah, and it's not one that you commonly hear associated with immunotherapy. So
it's probably radiation.
Now, all three of you received, among the three of you, you received 2 different types of immunotherapy, both targeting basically the same receptor, PD-1. Dr. Valchetti showed us earlier that that's that braking mechanism that cancer, uses to, or that the immune system uses to know, okay, I don't need to eat you or destroy you. And now, sometimes being tested for these prior to receiving these treatments has become part of the practice. I think maybe just for lung cancer right now. Did they have to screen you first to see if your tumors express something called PD-L1, which is the
I did hear that phrase.
Yeah.
That was one of those lots of numbers and things that were coming at me at one time. I did hear that phrase, but I think they made that determination after the biopsy.
Mm-hmm. Yes. Well, they would need to. They would need to actually look at your tumor and see, is your tumor expressing this?
Because I believe what they said was after the biopsy that they realized I was a perfect candidate for it because I did have the PD-L1 and I had a count of something else that was over 30 or something like that, that made me a perfect candidate for it.
I see. Okay.
And I also, I don't even know how to say that properly. I am PD-L1.
PD-L1.
I also have the BRAF mutation.
And was that a requirement for you to receive the immunotherapy?
I believe it was.
Okay.
Yes,
So these are those eligibility, like whether it's a clinical trial or even standard of care.
Actually, I have the BRAF mutation and the fact that it metastasized to my brain and was melanoma. I think those were the three factors that made me eligible.
Trifecta, right?
I also do want to share that that I do have side effect, but nothing major. It makes me tired. And in the beginning, when I first started the immunotherapy, the first several times that I had treatment, from the moment I started the drip to the end of the drip, which is a half hour, I literally was a normal person, and at the end of the drip could barely speak words. I was so tired. I actually do drive myself to treatment, and I live in upstate New York, and I would just go get a cup of coffee and sit in the cafeteria until I could gather myself together. I only lived a few miles away. But as time has gone on, and because I have been in treatment for 35 months, my body has acclimated to it, and that actually went away. There reached a point where I was, I think about 5 months later or 6 months later, and I was receiving my treatment, and I looked at my nurse and I said, "Did you put water in that today? Because I'm not feeling anything." And I no longer have that same experience, but I do usually have to nap afterwards when I get home.
All right. Well, let's switch gears. We're almost out of time, so let's talk about some of the practical things of receiving treatment. Were there any financial surprise, any sort of like things you might want to advise others in the audience? You might not think of this when you're about to do this, but actually you might want to keep this in mind. Terra, why don't you start with that?
I had serious financial issues. My dad had just died of lung cancer, actually, and I took off 9 weeks to go and take care of my dad. And I actually had tumors appear on the back of my neck while I was taking care of my dad. And so I came back home and literally had biopsies and found out I had stage 3 cancer. And it was very shocking. I didn't have money, I was broke. I knew I had to really act very wisely and very quickly. My boyfriend just broke up with me. I lost my house. My symptoms progressed so quickly. I lost my income. I was in a really bad place. So I think for me it was an advantage that I had had cancer the year before and knew the facts. So it gave me some preparation. And I went online, I created a GoFundMe, I posted it, and I kept posting it. I do have a very large friend base. I've been very involved in the community for a long time. But I actually raised $8,000 in the first month, and I raised $26,000 total, which actually helped me pay my rent for a year and a half.
So,
social media is my friend.
So, would you say, in addition to your A team, which sounds like your son Rigel was that A team, rock for you, if you have that, as Mary Elizabeth said, think creatively about your broader circles of people and don't be afraid to ask for help. That's what you did, basically, right?
Yeah, don't be afraid, because this is your life, and only you can really save it. And also tap into your local cancer support center, because there are lots of programs that you can apply for, and only they really know what those programs are that exist, and you can sit with them based on your situation, and they can really guide you. And they've been, my local cancer support center has just been, yay, thank you. They've been amazing.
Oswald, if there's one thing you could tell yourself then that you know now, what do you think it would be?
I would have to say that I realized the power of a positive attitude. I had been through some trials before, prior to getting the cancer, which I kind of believe those things had happened. I went through a depression phase that might have fed the cancer. My mother had passed from cancer. My partner of 26 years had also died within a 4-month period. And that was after 2 years of taking care of them. So that 1 year before being diagnosed, I feel that my state of mind was in such a place that it may have fed off the cancer. But being in the hospital, I had such a strong group of support. My friends were really, really, really supportive. And I believe that I had kind of resigned myself to, okay, well, this is the plan, this is my time. And it was my friends who really gave me the support and said, no, it's not your time, and you're not going to do. So I really would say, have a great support system. Have people who are going to be there with you, encourage you, and most importantly, do your research. I live in Brooklyn near 2 hospitals, but I went to Columbia. I'm a firm believer that your zip code can sometimes hurt you depending on what hospital you go to.
Well, it's
true.
it's true. There's health disparities. And
there is. So I personally feel if I had went someplace else, I wouldn't be having this conversation with you right now, because I don't think they would have had the capacity or the knowledge to introduce me to something like immunotherapy. So definitely do your research and know that you're going to the place that's going to give you the best treatment. And also, I believe just the way that certain hospitals treat you have a lot to do with how you react to the therapy. At Columbia, there's such a positive vibe moving through the hospital, from janitor to doctor to security guard, that is kind of infectious. And they make you feel and want to get better. So 2 things I would say: definitely have a support system, do your research, and choose the right place to go.
Very good. Dorothy, what would you tell yourself then that you know now?
Well, I endorse what
Can you hold the microphone?
The microphone.
Yes, I endorse what Oswald said about the support system. The team, and they call themselves that at Perlmutter, were amazing. The care I got there was amazing. Every single time I came, I was put through the blood pressure, and everything was checked. I was weighed. They fussed over, the loss of another ounce, and be very reproachful. And I felt very well cared for there. But if I hadn't had my daughter at home, I don't know what I would have done, because I couldn't. I had to go back and forth with taxis, and it was an everyday thing. It was 5 days a week with this hydration system. And before that, if I had marshaled her virtually, if she hadn't come down, I don't know what, I couldn't have done it by myself. And I don't have much of a support system. I don't have a wide circle of friends, and I didn't say much to anybody about my situation. But it was having this these close-in people, and what Ms. Williams spoke of this morning, the A team. My A team was a team of 1. My sister who lives in Brooklyn, but if it weren't for someone in the home with me, I don't think that I could have done what I would have had to be hospitalized really for that stretch when this anorexia struck, because I was helpless before it.
Wow. So support, and try not to do it alone if you don't have to, right? Okay. So we have some questions now, I'm sure, from the audience. I think we're going to start with, do we have any live stream questions? Not right now. Okay, so if you are watching on live stream and you have a question for the patient panel, feel free to ask. We'll be looking for that. Anyone in the audience have a question for any of our 3 panelists about their experience? We have one here. And please wait until they give you the mic before you ask. Thank you.
Hi. So this is for Oswald, because I know you mentioned doing your research. I'm sure you all did. Where did you go? Where did you get that? Where did you find it? Was there one place or a couple sites you kept returning to?
Well, initially, the first place I had looked was Sloan Kettering, because that's where my mother was. I had it was literally like about a 3-day stretch from feeling really, really bad, going to a urgent care, them telling me it was pneumonia, and then realizing something else was wrong. So I started looking at research and looking up online. I did the home doctor thing of going through my symptoms, and I came up with all kinds of things besides cancer. So I wouldn't recommend doing that. But once I did know that it was cancer and I was at Columbia, I did the research of what they were doing. And it might have said immunotherapy, but it definitely said that they were working towards other cancer things. So when I simply did the search for best place to go for cancer, 2 places came up, Columbia and Sloan Kettering. So I knew those were the 2 places to go. And since I was at Columbia, I decided to stay there. But after speaking to a few other doctors, I realized that I was definitely in the right place. Mm-hmm. So it's not just doing the research before, but even while you're in the process, sometimes you may find out something that another institution may be more advanced. As I said, I live in Brooklyn. If I was in Brooklyn at a hospital in Brooklyn and I did the research and found out about Columbia, I would have went to Columbia still. So it's not just about before or in the beginning. I think you should constantly be doing research just to see what's new, just to have the right questions to ask the physicians, and to make sure you're getting the best care possible.
Yeah, sure. Go ahead, Terra.
I actually did research like it was my 9-to-5 job. Because like I said, there was no treatment for me for 18 months. And I decided I could cave, but that's not really my personality. And let me tell you, as awful as anybody in the audience may feel, I felt really bad and I was in major shock. But I really wanted to live. So I did Google. I did everything in my power to research. And I decided that I wanted to be healthy if a treatment did become available to me. So I dove into nutrition and getting my body healthy, and I started exercising and doing Pilates, and I am a social tango dancer, so I went dancing as much as possible, and I did everything that I could do in my power to have as much joy as I could and to laugh. And I swear that those are the things that made me healthy enough so that when immunotherapy became available, I was healthy enough to receive it. And I swear that it's also why I've been able to tolerate it for 35 months.
And you also mentioned, just so Oswald's in Brooklyn, and he found, that there were better places to get treatment. You mentioned you're from upstate New York, and earlier we were talking, maybe you want to say a little bit about that.
Well, because I am a cancer patient advocate now, and I meet people all the time in person, and I run a support group, and I have a lot of people call me, I'm stunned at how people are not willing to travel or drive. So I actually drive 2 to 2.5 hours every time I have to come to New York City to see my doctors. And now, this far in the game, it's amazing meeting people who actually get on an airplane and fly in order to get here to New York City, to get to a research hospital. Usually it's, what I'm finding in talking to cancer patients is usually it's if they've had cancer return the second time. The first time around, usually people are willing to do, whatever, you're an individual. The second time around, you're willing to do anything. I will drive, I will fly, I will do whatever I have to do. If I'm broke, I'll find a way to come up with the money. I will get wherever I need to get the best information. And I advise everyone that I talk to get to the closest research hospital that you can, because that's where you're going to get the most progressive information. And the quality of care, the kindness, the professionalism, it's absolutely amazing.
And Dorothy, it sounds like your family was a good resource for you.
Yes. Indeed.
Can you hold the microphone again?
But principally my daughter. Just say there's one indispensable person, I believe, and I was fortunate to have, about money, Medicare covered all my treatment with a supplement. My husband was an Air Force pilot, so I have what they call CHAMP VA insurance. It's a military insurance. Whatever Medicare didn't cover, CHAMP VA picked up, so I didn't have to put my hand in my pocket once for this very extensive treatment, 5 days a week, as I say, and hospitalization and daily hydration and the blood transfusions. When I see these sums on paper, they're astronomical, you know. So that was very fortunate. Yeah, you certainly do need help. You do need help.
Do we have another question from the audience in the back there? Here we go.
So, a bit of a segue to what I was going to ask. I was going to ask a question about whether or not you were required to make changes to your diet or lifestyle when you started on your immunotherapy treatment program.
That's a good question. Yeah, go ahead.
It has never been suggested by any doctor.
So you took it on yourself?
I took it on myself.
Well, my cancer developed from being a smoker. I started smoking out when I was 14, so at the time the cancer came, that was about 36 years. So they did kind of suggest that I stop smoking. Besides that, there was no dietary restraints or anything like that. And they also suggested I be kind to my liver and my kidney, you know. My family's from Trinidad. We like to party a little bit. So, you know, they did mention to be kind to my liver, but those were the only two things that they really did say. They suggested I stop smoking, which, you know, 3 months in the hospital kind of makes you stop smoking. And just to be kind to your organs, they made sure I drink a lot of water, try to be healthy. But like with anything else, any other sickness, any other treatment you're going to, you want to make sure, as she said, your body's in the best condition that it is. I found going to the gym, huge help. Huge help with any aches and pains you may have. Even though I never had pain, they gave me pain medicine, but I took myself off it because I actually never felt any pain throughout the whole time I was on that I've been on the immunotherapy, because I'm still on it. Yeah, but there was no dietary or anything, and no changes. My basic food stayed the same, and I just stopped smoking, really.
I will share that my doctors say, Tara, whatever you're doing, keep doing it.
Dorothy, any lifestyle changes your doctors told you to take?
Not outright, but at Perlmutter, there was a sort of kiosk with a lot of offerings or programs, and amongst them was something to do with nutrition. And I attended one once, and it was really very lovely. It was conducted by a chef, a known chef downtown, and the participants helped with the food preparation for the lunch. And the chef gave this sort of line of patter which talked about organic vegetables and so forth, and we all enjoyed it. And so it was kind of implicit. I assumed that cancer of the esophagus would have something to do with food ingestion. It seems logical to me as a tube that's been pelted with food for, a half century and more. But no, the marker for that is smoking solely. So I wouldn't say that it was emphasized, and nothing in the dietary line was emphasized, but it was peripherally it was brought in. Yeah.
Very, very interesting question.
Can I share? I do choose to eat organic at home, and I also made a conscious decision. Cancer just changes your life. It changes the way you see everything, the way you think, the way you feel. It was what made me realize it makes you appreciate life. And I made a conscious decision. I got all toxins out of my house. I changed how I was cleaning my house. I changed how I was cleaning my body. I changed everything that came into my household.
So just doing what you can to...
I say to my doctors, you do what you're great at, and I'll do my part.
Another question from the audience, right here.
Hello, I'm Valerie. Thank you so much, this panel. You mentioned, Terra, about social media, and also I wondered, have you all either started forums or run forums or considering creating forums for the information that you have and your experience?
Have you started a forum? But we'll, since on the internet. Let's start over here, because I know you'll have a good answer to that.
I really don't haven't started anything, but I do interact. Friends who know what I've been through, if they have a relative that's going through it, they offer, well, maybe you should speak to my friend. So I do a lot of that, especially because even when I say the word immunotherapy, there's a lot of people that still haven't heard about it. They have no idea what it is. So a lot of times you're speaking to someone who only believes their only options are chemo and radiation. So I do a lot of informing people who come to me and ask me, but as far as actively starting out a forum or any platform, I haven't done that.
Dorothy?
No, I have no social media presence at all. I can barely operate email. It's passe already. So I'd have to pass on that one.
All right. So now, Terra.
Well, I feel driven. I realized something in preparing to get ready for today, that I could actually list on paper all the bad things that have happened to me, but I can't list on paper all of the magical miracles that have happened to me through this process. So because of those miracles, it's beyond me, it's coming through me. I am driven to give back the miracles to as many cancer patients as I can. So a year ago, I started a cancer support group of my own in upstate New York. I think outside the box, so the other support groups didn't really work for me, so I created the one I wanted. I do want to publicly continue public speaking, which I started about a year ago. And I am writing a book also on coping skills through stage 4, because with my friends and my doctors, that's what I'm known for, is how well I've coped through this situation. So my intention fully is to help as many cancer patients as I can.
So it's just been so wonderful to hear all of your experiences, and I know that there are many in the audience who are going to want to approach you after this, and they will have an opportunity to speak with you. Before we break for the breakout sessions, though, I also just would like to give a round of applause to the scientists, to the organizations, to the companies that have all worked to make immunotherapy possible so that these 3 people could be on the stage here with us today.